And for more on the race to vaccinate the U.S., Dr. Julie Morita of the Robert Wood Johnson Foundation, who worked for President Biden's COVID transition team, is joining us now. Dr. Julie, good morning. Thank you so much for being here. We know that infection rates are falling in the U.S. and around the world. What do you think is causing that drop? Is it people developing immunity from having the virus, people being vaccinated, more precautions, or a combination?
Morning. Nice to see you again. Yes, I think there's a number of different factors that could be contributing to this decrease we're seeing in numbers of cases. It's reassuring to see the cases coming down, but we're still at high levels of disease activity. But things that could be contributing to that decrease include the social distancing and the prevention measures, people really taking seriously the fact that they shouldn't be in large groups and gathering together. Those kinds of measures have made a difference and can continue to make a big difference, so they need to be continued. In addition to that, vaccine distribution and vaccine administration may actually be contributing to a little bit of a decrease as well, but it's pretty early because the levels of protection are pretty low. So those kinds of things in general can definitely be contributing to the decrease in diseases that we're seeing. There's also seasonality that we see with diseases like influenza, like COVID, where we have peaks of activity when it's colder, when people are in homes, and congregating closely together. So those kinds of factors can definitely be contributing.
And you wrote an op-ed this month calling for more equity in vaccine distribution. What are some of the problems you're seeing, and what do you think needs to be done differently?
I think we're looking at high numbers of people getting vaccinated, and so that's really reassuring. Tens of millions of people have been vaccinated already, about 12% of the population. So that's all very reassuring. I think the key thing to keep in mind, though, is that it's not just about how many people are getting vaccinated, but who's getting vaccinated. We know that this pandemic has really affected communities of color, African American, Latino American, Native American communities, much higher in terms of rates of hospitalization, death, and just poor outcome. So it's really important that those groups get vaccinated as well. And so the systems have to be built in a way that make it easy for them to access the vaccines too.
And I know you have worked on vaccine distribution on both the federal and the local level. We have heard from some local leaders that the process can get confusing with so many cooks in the kitchen. So how do you think the government can coordinate better to help ramp things up?
In my past experience at the health department in Chicago, the strongest and best in public health emergency responses were led by the federal government in coordination with state and local governments. Clearly, we are at the front lines of local public health, and state public health are the front lines of the responses. But in order for the process to be smooth and to go well, there needs to be leadership at the top, at the federal level, with close communication and coordination with the state and local governments as well.
And Los Angeles schools are able to open today based on COVID rates in the area. Last week, the CDC released some guidance for reopening schools across the country. Based on your experience, what are the top considerations for school administrators right now?
It was really reassuring to see that the CDC issued this school guidance last week. It's evidence-based information that gives more specific guidance in terms of what kinds of criteria should be met and what needs to be in place to reopen schools safely. So there's a color coding that is associated with how much disease is going on in a community, but there's also guidance regarding masking, social distancing, ventilation and cleaning within a school system, and also a close connection with public health entities to make sure that when cases are identified, that people can be isolated and quarantined as appropriate. So the measures are really outlined nicely within the CDC guidance and should be helpful to state and local governments as they're reopening schools.
Dr. Julie Morita, great to have you. Thank you for your time today.
Thank you. Take care.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.